Hello once again, everyone. It's very nice to come your way again today. You are welcome to the pharmacy. I am your regular host, Paul Abdurrahman Issa Dowona, or Parid for short. Once again, we have a very interesting topic for discussion on today's episode. We are discussing drug abuse and polypharmacy. What is drug abuse? What is polypharmacy? I'm sure you've heard drug abuse being used in a lot of ways. Today, we are going to dive into the topic and see what it means to say you are abusing drugs. We'll also go into polypharmacy and what it entails. Have you ever bought a drug for headache and then your sister said she was having headache and you gave the drug to your sister? Is that the right thing to do? Have you ever bought a drug for stomach pain and then your friend said, Charlie, my stomach is paining me, and you said, oh, Charlie, yesterday I bought some drug, come for it. Is that the right thing to do? Have you ever gone to the pharmacy and you've been given a drug to say, take it 2 times a day? You decided that, look, 2 times a day is not strong enough for me, so I'll take it 4 times a day. Have you done that before? What does that mean? What are the health implications of these decisions? That is the crux of today's topic, which is drug abuse and polypharmacy. Join me after this break. Thank you. Welcome back from the break, everyone. As I indicated before the commercial break, today we are discussing a very important topic. You've all gone to the pharmacy, say you have body pains, and then you have headache, and then you have fever. So you go and you say you should be given a drug for the headache, you should be given a drug for the fever, you should be given a drug for the body pain. Is that the right thing to do? If it's not the right thing to do, what are the consequences of taking drugs in that manner? So our topic for today is a huge one, but we have the people to help us dissect it. We are discussing drug abuse and polypharmacy. They sound as big words, but before we are done, I'm sure we'll all understand what these terms mean. Once again, we are delighted to have Pharm Adams Akram. He's a pharmacist of quite a considerable number of years of practice and currently works with M-Pharma. Pharm, you are welcome.
Thank you.
Today we have a celebrity guest. As you know, is the custom of this show. Just so that we don't make it too technical, just so that you, the viewers, feel a part of it, we always bring a lay person, quote unquote, to also bring his or her 2 cents into the topic we are discussing. Unfortunately, today we have somebody who is more than capable to make this topic livelier and more interesting. I'll let him introduce himself. Masa.
Yeah. My name is Pharm General Ntatia. Yes,
when did you become a farm?
I'm a farm. I have a lot of farms. Yeah.
So it's not a pharmacist farm?
No, I have a farm. It depends on the kind of farm that you're talking about. But I have a farm.
Which farm do you have?
I have one at my hometown, at Nancy Formula. I have a farm there. And then also, I don't know if you know Kwabenya.
Yes, I know Kwabenya.
I have a farm.
At the back of Kwabenya, I have a farm.
Yeah, that's the one area called, I've forgotten the name, but I have a farm there too. We are into pigs. Pigs and...
Please, when you meet him in town, don't call him farm. He's General Ntatia. Don't
call him farm?
Because he's a pharmacist.
I'm also a pharmacist.
What medicine do you sell?
I don't sell medicine. We cultivate crops. Okay, if I wake up in the morning, I tell them I'm going to the farm.
Yes.
You also go, I'm going to the farm.
He doesn't say I'm going to the farm.
What does he say?
He says he's going to the pharmacy.
Ah, okay.
Viewers, that's General Ntatia, and as you can see, it's going to be a lively conversation. But let me start with you, Pharm Adams. Briefly, explain to us what drug abuse is and what polypharmacy is.
Okay, thanks for the question. So I think drug abuse is quite topical in the world now. And I think bodies like the WHO has come up with a lot of data, statistics around it. So basically, drug abuse, you are talking about using a drug. The drug can be an illegal drug. It can be a prescription drug. It can actually be an over-the-counter drug that you are using.
What's an over-the-counter drug?
Oh, that's a drug that you do not require a prescription for, typically. Okay. You could walk into a pharmacy.
Don't go to the counter to go and buy.
But it is over the counter. You have to go to the counter.
Yes, I thought over the counter. Like, if you don't go to the counter to buy, like this counter that we have, don't buy it there, then it's over the counter.
That is not it.
It's a general term we use for drugs that you typically wouldn't require a prescription for.
Okay.
So all classes of drugs can be abused.
Okay.
Basically, if you use it in the wrong way or manner, then that is typically drug abuse. But there are a bit of things that we have to spread out. For example, you hear drug dependence, you hear drug tolerance. So as part of drug abuse, using it wrongly, you could look at drug dependence as I'm taking the drug and I can't stop it.
Okay.
So it becomes like an addiction. I can't stop it. You become dependent on it. And so with physical dependence, even when you try to stop taking the drug, you already have side effects. For tolerance, maybe you go to buy paracetamol, you take 2 tablets. And
is this side effect what they call withdrawal symptoms?
Exactly, withdrawal symptoms.
Okay.
Because of the problem, I'm trying to make it as bare as possible. Okay. But for tolerance, you buy a drug, typically you take it a certain number of times a day in a certain way. But because you're on it for a long period of time, after a while you take it and it doesn't work. It will mean that you probably have to go in for larger doses. I think quite recently we hear about the addiction and abuse of certain codeine, I won't mention the names, but codeine-containing products that some of our youth, unfortunately, acquire, however they acquire it, and then they sort of mix it with energy drinks, and it gives them this haze, and they misbehave about. All of that, it's an illegal use because the drug is not meant to be used that way, and so once you use it that way, it becomes a problem. There are challenges around controlling it, especially if a drug is a prescription drug or it's a codeine-containing drug. Obviously, it's a narcotic, and you typically cannot walk into a pharmacy and demand for it without prescription. Even the prescription has to be properly authorized. The person at the over-the-counter should be able to verify that this is coming from a qualified physician that you can trace and talk to when there's an issue. Okay. And so those are the issues around it, and these pose a great threat to the victims, because then what it does, it affects your quality of life. You can't seem to socially, you can't relate socially.
You can't concentrate.
You can't concentrate.
Exactly what I want to say. I think you're on the path.
Yeah, thank you, sir.
We're not talking about farming,
no, we are talking about pharmacy here.
But why are you making it as if you know pharmacy?
And the thing that are in my head is saying exactly the same. I'm even shocked.
Okay.
So over time, there's been the need to educate the public. People need to understand what is happening, what the dangers are, and how what we can do to protect it. We as healthcare providers have a very critical role to play. So if I am within the pharmacy or in the healthcare space where I have direct access to these medications, it is for me to be a check onto who gets it. So the person only gets it when you can independently verify that the person needs it and all the requirements have been met before you give it out. So even my setting, if you come in and I see that you are a chronic patient, you keep coming, even though you may come for a valid prescription, and I see that the frequency is abnormally high, I owe the patient a duty to maybe call the physician and say, this is what I've noticed. Have you noticed it, or is it something happening behind your back, so they can make an intervention and come in timely? I'll
bring the other farmer into this conversation very soon.
Okay.
But back to your conversation on drug tolerance. Help me and my viewers to understand. So I have come across instances where somebody has come to the pharmacy and you give me, let's say, paracetamol, and you say, take 2-3 times a day, and he says, oh, me this is paracetamol, if I take 2, it doesn't work again. I have to take 4 at a time or 5 at a time. Is that tolerance? Is that dependence? Is that abuse? What is that one?
So you can look at it as abuse. Okay. So abuse could be the mother term, and under abuse, you sort of have different kinds of abuse and what they lead to. So tolerance will be under that, because you are getting tolerant to it because you're abusing it. You're not using it the right way you should use it for. And so your body typically would sort of adjust to it. And so what will be typical dose, you cannot benefit from it. But that is not to say you actually can have patients using drug the right way but develop tolerance. In that instance, it is left onto the healthcare provider to advise you. So sometimes the patient has a certain pain. It's on para. After a couple of months, it's not working. There are things that whoever you meet at the pharmacy can ask you, can determine, and may be able to step up your therapy a bit, add on another drug, or change the drug entirely to something that would better work for you, that you wouldn't have to take as much as you do the previous drug.
I'll come back for you to tell us what are the effects. We'll talk about the effects of these tolerance and, I mean, abuse before we discuss polypharmacy as well. Okay. But, General, so far, what are you gleaning from the conversation?
Oh, we, the healthline personnel, we've come to understand right now that, you know, in order for the viewers to understand things, you don't have to just walk into the pharmacy and, you know, buy drugs. Just understand what you are going to buy and what you are going to take in. So you don't just wake up and go to the pharmacy and go and buy. And also as a pharmacist, when you are selling, make sure that somebody comes over and over again to purchase the same drug. You know, you should follow up and see what is wrong with them. I think most of the times people just go and then the pharmacist also, I'll sell it. But I think we have to be careful on what we are selling to the people and then how many times they come in.
But when you say we the health worker, what are you talking about? What do
we the health person?
You and who?
I'm a health person.
What do you do? Are you a pharmacist? Are you a doctor? Are you a nurse?
I make people laugh.
You make people laugh?
Yes, and they say laughter is medicine.
So that's
ours is a special program.
It's actually therapeutic.
Yes.
So are you now saying that it should be mandatory for us to have a comedian in the pharmacy at all times?
It's very important. Sometimes you even need a comedian at the hospital. So those who have accident and we do some stand-up comedy.
If you can afford it.
Yes. You can afford it.
I think it's something that we have to look at. You know, the government have to look at and then just get some comedians and actors at the hospitals and then your leg is hanging in the hair and we'll come and probably just squeeze it or break it off for you to see that we are not joking in this country.
That will be murder. That will be murder.
Viewers, we'll take a quick commercial break. We'll be right back. Welcome back, viewers, from the first part of the program. We had discussed, we had had a very interesting conversation. We've spoken about drug dependency and what it means, spoken about drug tolerance and what it means, and we've also placed these two under the broader umbrella of drug abuse. We'll pick up the conversation from here and also veer into the subject matter of polypharmacy and see how all these things are interlinked. And also discuss what are the implications, what are the health effects. Pam Adams touched on some of the effects of drug abuse, but we'll hone it home properly before the show ends. But before you go, General, do you have any story of drug abuse? Have you abused drug before, or do you know somebody who has abused drug before?
Oh, as for me, I have not abused drugs before. But my grandmother did. You know, blood tonic.
Yes.
You know, it's very sweet.
Yes.
So the thing was in the house, and then she kept drinking it.
Okay.
Then she was getting bigger.
So it's just a blood tonic.
Yes, blood tonic. She didn't know she was abusing it.
Yeah. No, but that's an interesting scenario he gives. That sometimes, and when she was growing big, and when you ask her, why are you putting on weight? And so it's by God's grace. No, and it's the blood tonic. Do you find in the pharmacy, especially with these drugs that have immediate physical effects? I mean, there's the issue of steroids for bodybuilders, the issue of appetite stimulants for. In fact, I hear a story of the fact that when some people want to get married, there are certain appetite stimulants that within a month they use it so that they can eat well and all their cheeks and every part will fill properly. Yeah. And I think General's analysis of it, maybe the grandmother didn't see that it was abuse. But do you see these things in the pharmacy? Do you think that sometimes abuse is an issue of ignorance? Or you think at all times it's actually a deliberate decision to abuse the drugs?
Yeah, you're absolutely spot on. It's partly deliberate, and then you also have ignorance plays a part. I'll try to dovetail that into polypharmacy. Okay. And the irony is that when you look at drug abuse, it's mostly predominant among the younger generation. Okay. Polypharmacy is more in older adults. And the reason is simple. we are young and impressionable. We want to, once you hear the new thing in town, you want to try it and see what it does. It gives you a haze. Before you realize, you lose consciousness of yourself. You don't know what you are doing, and it affects your quality of life. As if, for example, if you're in school and you start to abuse, and I, in my secondary school, I know a senior of mine, a very brilliant chap, and unfortunately he went the way of drugs, and I mean, he lost. When you look at him, it's an embodiment of what drug abuse is and what you should not do with drugs. Okay, I think sometime along in life he found his way back, but that can tell you that for someone who can't, your life goes down the drain. And it's quite important because it's a topical issue that the healthcare system is trying to fight, but at every point you have barriers. In his case, his mother probably was taking a drug that the side effects maybe is long-term or non-existent because the drug is a bit safer. It wouldn't have been the case. It was a much more dangerous drug. It could have killed her in a shorter time. I back in pharmacy, and we say in pharmacy 101, when you're doing pharmacology, toxicology, there was a scientist, I think nearly 500 years ago, called Paracelsus.
I know him. I've read a lot about Paracelsus.
He's a Swedish.
What do you know about
Swedish.
He's
a Swedish.
You didn't know it was Swedish. You didn't know it was Swedish. You didn't know.
Swedish.
You're waiting for him to say it. You didn't know.
It's a pharmacist, right?
No, he's a Swedish physician and chemist.
Yeah. How is that the same as pharmacist?
He was becoming, but then they changed his mind.
And what he did, I mean, he's probably right, because then the origin of pharmacy was you could be a chemist. It actually evolved to pharmacy, but someone could be a chemist and was clearly a pharmacist, so to speak. But what he said, and it's still relevant today, anybody who studies toxicology, that every drug is a poison. The difference between a drug and a poison is the dose. So at a certain dose, it's a drug, it gives me relief. But at the wrong dose, at another dose, it's clearly a poison, can kill you. Now, depending on the molecule that is involved, you could actually have a long-term effect or have an immediate one. So dovetailing that into polypharmacy, that usually, the basic definition is anybody who uses, or the practice of using at least 5 to 9 different drugs for whatever reasons. And usually it's in older adults, and the reason is that they tend to have multiple conditions who have been treated by multiple specialists. But there is interaction in drugs. So if you have someone taking as many as 9, 6, and in the pharmacy you actually have people who have hypertension, diabetes, prostate disease, and they come in and you see their drugs. You're looking at one person. Wow. You're looking at 6, 5, anywhere between 5 and 10 drugs that they take regularly. And that opens a person up to side effects, because when I take that, these drugs can interact unknowingly. So I may take drug A for this condition, drug B for this one. That is well and good. But the two, when they work together, what effect does it have on you? And so in advanced countries, there are tools and softwares and systems that these drug dispensing bodies have. So when your drugs are put in, it can tell you that potentially this drug may interact with that, and so you may have to change it to another drug. And so the pharmacist can, or the physician can make an intervention and change. Over here, we don't have those systems, so it's left with we, the healthcare professionals, to be mindful. It's not about making money. So if you come in with 6, 7 drugs and it's consistent over a period of time, I should be able to make an intervention. And look, if there are no interactions and it's fine, okay, but when you check and you see that potential, because these physicians may not be speaking to each other directly, and I am prescribing for what I think you are suffering from. I don't know what another person is prescribing, but we who are the final phase where they come to pick these drugs, we owe it a duty of care to make sure that these people are properly educated. If there are areas where we can make changes, then we make them. Because our parents may be involved, because most of us, your parents have hypertension, have diabetes, high blood, cholesterol, what have you. And the tendency is that they will prescribe multiple drugs, and that is where it is important.
I have one question.
Please.
Okay. You were saying, from Adams, you were saying something like one person, taking a lot of drugs because of the condition, a lot of, illness around. Sometimes you go to a pharmacy you know that you have headache. You go there, and then you say that, oh, I want maybe paracetamol. Then they will ask, do you cough? Do you feel some heat in your head and all that? By the time you get out of the pharmacy, you have about 15 medicine that you are taking out. Is it a good practice, or is it something that is normal? In
itself, it's not a bad practice, like I said. So you may be on multiple drugs that are fine. Only a few days ago, as part of the Pharmacy Council, you know, as practitioners, you have to keep yourself updated. We attended a continuous professional development course on pain and fever. And someone can walk into a pharmacy and has a high temperature. So in most instances, there were studies that showed that some people assume that, oh, your fever is because you have malaria and prescribe you malaria. And so there was someone for the malaria control program that showed statistics that out of a certain number of cases that were assumed to malaria, at the end of the day, it wasn't malaria, maybe something else. It is possible that you may walk into the pharmacy, maybe seeing you have a slight cough, or as a healthcare professional, I want to treat you holistically. So what you have may be a symptom of something. So, I mean, you have a headache, yes. Do you cough? Do you have pains anywhere? Okay. That may guide me in investigating further. Is there another condition you may have? Yes. So if it is possible that those other conditions exist, then the healthcare professional should be able to give you any number of drugs, if there isn't one that can do, or any number of drugs that can cure that. But those drugs, the important thing, they must make sure that they don't interact and they do not interfere with your well-being. Otherwise, then it becomes a...
Yes, and thank you for the answer to General's very important question. But you would also agree that on the flip side, there are also some pharmacy practitioners who just want to make money. Because I have also been witness a case where somebody was being treated for malaria. He was given a drug for malaria. He was given a painkiller. He was given a blood tonic. And then when the person finished, he added an antibiotic. And when he asked, what is the antibiotic for? He says, oh, after the anti-malaria has killed the parasite, the antibiotic will clear the parasite out of the system. Clearly, antibiotics are not for clearing parasites in the system.
Yeah, I mean, it's sad, but I can't hold brief for my colleagues who may be out there, or people who may purport to be pharmacists or dispensing technicians when they are not. Even in instances where, and I'll tell you what, there was a very recent case, somebody I know closely, who was a medical practitioner who got addicted to an opioid. He knows, this is someone who knows very well what it should be used for and shouldn't be used for, but was addicted to it. And the person died later on. But that is just to underscore that even as healthcare professionals, there are people out there who, I mean, it's a pharmacy. I mean, sometimes I go out and I see some pharmacists who say they have a sales target for the day. If you're a healthcare facility and you set a sales target for the day, I mean, you're just saying that when someone comes in, try to sell as much as possible. But in healthcare, if the person can, there are people who come in who say they want something, but upon investigation, it is not a drug they need. They just need some counseling, a lifestyle change. And so when you put those things in place, it becomes a challenge. I know that the Pharmaceutical Society of Ghana and the Pharmacy Council is clamping hard on these such facilities. And they are making sure that every pharmacy should have at all times a dispensing pharmacist available who at least have a certain level of knowledge. And the program I attended, there are CPD programs that should make sure that things are changing, trends are changing. So as a practitioner, you have to keep in tune. And so as a pharmacist, before you can renew for your license for the next year, you need to have met a certain number of CPD points, which means that you should have attended those programs to upgrade yourself to be relevant for the coming year. And so they are putting all these measures in place. I can't say that all those things are working 100%, but of course there's still a lot of room for improvement. And I think that with the interventions in place by the authorities, sooner than later we will get there.
Okay. General, we are wrapping up. From what we've discussed so far, what will you say should be the role of the pharmacy in helping to curb drug abuse and polypharmacy? What would you say?
I think you said something about meeting target and all that, so they should look at it again.
Yeah.
Probably maybe come up with some measures that will not put pressure on those working at the pharmacy, so that when people come, they will give them the right medicine, not to have the mindset of making money, which at the end of the day go to cause the patient who is coming to buy their medicine. So I think those are the things that we have to look at. There should be some measures to curb all those things, so we don't give people medicine. Because I asked that question based on an experience.
Okay.
I was having only 2 CDs and I was going to buy paracetamol. And the person asked a couple of questions, and then everything by everything was around 300 CDs. I started bringing everything back one by one. We came back to the 2 CDs. I paid and I got it.
Yeah. So you could have given you that one drug, but exactly, yeah.
So, so I insisted, and so this one, what will you do? So if it will this one is antibiotic.
Yes.
So I think antibiotic, we can fight, the system can fight now.
Put
that side.
Yeah.
We came back to the 2 CDs. I paid and I went home.
But quickly, there's one major issue. So one aspect of polypharmacy. So General is my friend.
Yeah.
And he tells me maybe 2 days ago he bought a drug for headache and some kind of pain that he has at home. He didn't finish it.
Yeah.
So the 2 days, a few days later, I also have the same pain. I called General. Charlie, you have some drugs. I have a pain. Can you give it to me? I mean, that shouldn't happen, because you may have pain, you may have whatever condition. Between the two individuals, the situation may be different, and you need someone who is a bit more qualified to say, okay, take it or not take it. So I can't just come to you because you have taken it for this, and I take your drugs and then go and continue.
We do that a lot.
Yeah, it's a practice that I think that people should stop.
Okay.
Because everybody, based on your circumstances, you are prescribed. And so if I feel I have the same thing, I should go back to the source and
not share it with them. Thank you very much. Viewers, all too soon, our time is up. We'll draw down the curtains on today's episode. Thank you, General, for coming.
Thank you.
Thank you, Farm, for your elucidation and a very clear education on drug abuse and polypharmacy. So the viewers, the main takeaway is the fact that every drug can cure and every drug can kill. So when you go into the pharmacy, allow yourself to be treated by the pharmacist who has been trained to give you that care. The time seems short, but I think a quote from Winston Churchill will be appropriate in this instance. I mean, Churchill says, and I quote, "A good speech must be like a woman's skirt, short enough to reveal interest and long enough to cover the subject," unquote. Thank you very much.